Okay, I think we're ready. Good afternoon, everyone, and thank you all so much for participating in another one of our developmental screening summer webinar series sessions. My name is Dr. Teresa Northington, and I am the developmental screening coordinator for the Bureau of Family Health. And it is my pleasure today to introduce today's speaker and webinar session, which is aligning practice with the keys to unlocking EHR integration for developmental screeners, part two. Before we begin, I will read the disclosure statement, which is Brian Richmond has disclosed that he has no relevant financial relationships. All remaining faculty, Louisiana AAP Education Committee members, and staff members have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. All relevant financial relationships have been mitigated. For participants, social workers, registered nurses, nurse practitioners, and physicians who would like to receive CE and or CME credit hours or contact hours for attending today's session, please be advised that you must attend the session in full and complete the evaluation at the end of the webinar, and it will also be emailed to you today. Today's speaker is Mr. Brian Richmond, the Chief Technology Officer at Louisiana Healthcare Quality Forum for 12 years. He brings over 35 years in information technology experience to the state of Louisiana, including 30 years in the healthcare field. He holds an MBA from Southeastern University and holds the HIMSS Certified Professional in Healthcare Information and Management Systems certification. He is also a veteran of the Air Force, the U.S. Air Force. Without further ado, I present our session and Mr. Richmond.
Great. Go ahead and good afternoon, everyone. Excuse me. There we go. Can you see my screen okay? Great. Great. Good afternoon, everyone. Thanks for joining our session today. As Teresa mentioned, I'm Brian Richmond. I'm the Chief Technology Officer here at the Louisiana Healthcare Quality Forum. Today, we're going to be exploring some of the advanced integration strategies to integrate developmental screening tools into your electronic health records, focus on opportunities for perhaps creating custom fields, enhance clinical workflows, and improve patient outcomes. Here's just kind of a brief overview of the session with the introductions that we've done, a little bit of recap, including what was discussed last year in the 1.0 version of this for those that may not have been able to attend last summer, and then our objectives for the session, Q&A at the end. So just to real quick go back for 2020 for the session for last summer, our objectives were to facilitate data integration within the EHR, how we can enhance and promote workflow awareness of these changes throughout the clinic, and then promote those effective use of the screening data that's collected within the EHR. Again, we're focusing on those three areas, promoting the effective use of screening, and it laid the groundwork for today's discussion about how we can build on these achievements with new integration techniques. So our learning objectives for today are you'll be able to understand how to customize EHR to better capture developmental screening data, learn how to use standards-based approaches to enable the secure exchange of data within the clinic and amongst providers across the community, and then explore how quality monitoring, and then we'll talk about some real-world evidence of how this can drive improvements in reducing disparities and improving outcomes in our communities. So moving on to objective one, our advanced customizations. So in objective one, we're focusing on building on the flexibility of the HR to support developmental screenings, the ability to customize fields, conditional logic. What I mean is if a particular score is reached or a particular question within a screening is answered a certain way, how can the EHR automatically drive the clinician in a particular direction? Does that open additional questions? Does it automatically generate a referral? Those types of items that we can do, leveraging one of the important components of being structured data. So first thing we're going to talk about is the advanced integration approaches. So one of the things that EHRs allow very powerful for is customization of capturing information. A lot of systems capture that information as text by default. So it's real important to be able to work with your EHR vendor and your local administrators to customize and enhance the EHR to actually capture the scores, the individual responses within the screening and the scores, and discuss those key decision points of if scores end up in being in different ranges, what do you want the HR to do to perhaps automatically provide a notification to the provider, automatically generate a referral, ensure that information is automatically carried forward, not only within this particular encounter, but in future encounters, so that the provider has that in their active medical history. Some of the customization examples include integrating like the ASQ or the MCHAT questionnaires into those fields. A lot of systems, most EHRs today have patient portals and the ability for the parents to perhaps electronically fill out those screenings ahead of time before the visit, or it may be making it easier to hand them a tablet or walk them through the screening during the visit that day. This information then can be forwarded into the encounter as part when the provider meets with the parent and the patient. And like I said, it's real important to be able to incorporate the logic within the forms to if screenings are outside of normal range, or like I said, some screenings have particular questions that flag certain responses to help automate those items. It's important to note that when you're doing the development of this, that you do have an integrated approach to that you're working through with the other care team members to understand the downstream impacts of if the screening generates a particular result and the expectation is that gets forward on to a different caseworker to help with a referral for outside services, that person knows where to look and what to expect, and is the referral providing all the information needed in order to effectively assist the parent or the child with the screening. One of the areas that helps this across multiple organizations is there's an organization, global organization called Health Level 7, that identifies and develops standards not only across the United States but across the globe. There's a foundational component of that called the U.S. Core Implementation, and they've actually developed screening tools and assessment guides on how to implement these screenings within the electronic health record systems and your workflows. You can see they have a process of performing the screening and assessment, identifying the condition, setting a goal based on those conditions, automating the initiation of the intervention, completing the service, and it just becomes a continual service loop within that platform. You can see we've included in the presentation a link if you want to do additional reading on what the different assessments and screening options are provided within by HL7 and their best practices. Moving on to we're going to move on to objective 2, which is securing interoperability and secure exchange of information between provider organizations. So in objective 2, we're addressing interoperability, secure data exchange. We're going to cover strategies for integrating screening tools within the external providers, within public health systems, and addressing some of the workflow challenges and leveraging these. Some of the approved standards, as I mentioned, there's an organization, HL7 is the foundational organization that provides electronic data standards for that all electronic health systems follow today. They have a specific area called, you may hear people call it FHIR, which is a fast health resource. It's a more advanced resource that allows EHRs to more effectively talk to each other and defines, it says this is the piece of information and this is what it means, and not just sharing just a number, for example. They have some of the examples that we would use are with these secure platforms and with integration across different organizations. There are several different organizations across the country that interconnect electronic health record systems. I'm sure if you've used your provider's electronic health record system, or you as a patient have seen like Epic's MyChart, for example, that allows any provider hospital across the country to automatically share information amongst all of that customer base. There are also national networks that are being supported by the US HHS and the US states that have it's called TEFCA. They've developed a regional coordinating agency to coordinate sharing of information across electronic health record platforms, health information exchanges, and different other clinically related platforms. Have those things be automatically shared with electronic authorization across providers. So not only within the local community, but if the referral needs to be to a specialist that's outside the local area, their systems are integrated into these different networks to support the transition of those referrals. All these are supported by industry standard best practice security concerns that ensure that not only the person sending the information related to the referral is authorized to do so, but that the person on the other end that's receiving it is indeed a authorized care provider, and that the patient has consented to having that information, or their guardian is considered to having that information shared. So we've seen examples where having automated results to the child's pediatrician or an early intervention program can help ensure continuity of care without having to deal with manual faxing, mailing forms, etc. This this information can also potentially be shared with school health clinics, giving them time of access to screening outcomes that may guide how that particular person is, what their individual education plan is going to be, and focus on improving outcomes. Excuse me. So objective 3 is focusing in on quality monitoring and the implementation of some of these recommendations. Uh, Obviously, the focus would be on quality assurance and improvement, monitoring the effectiveness. So, looking at completion rates, evaluating the accuracy uh, of the information that's entered in the screening tools, that the changes where you've incorporated conditional logic into the workflow to automatically generate referrals or escalate flags to provider, for example, that those triggers are occurring and that the person receiving those notifications or referrals are indeed able to view them and act upon them accordingly. This just requires, again, a continuous improvement cycle, feedback loops, and it's an iterative process of, the first time everything looks really good on paper, we make the changes, and then you get into the situation of implementing it in the clinic, and there's always some adjustments that need to be made as you truly incorporate that into the workflow and use those new features and capabilities that have been added into the EHR. One of the real world use cases that we've seen is a recent study that involved a pediatric organization, large pediatric clinic, that incorporated the automation of their developmental screening into their practice, and where they've seen completion rates going from, the screening assessment times going from 20 to 30 minutes to less than 10 minutes, seeing follow-up rates improve from 60% to over 85%, all by leveraging the electronic health record systems and their interoperability and those connections to automate those referrals. Don't have to worry about faxes getting lost, emails getting caught in junk mail, those types of services. So, sorry, I lost my note. And this study covered more than, was over 2 years, covered more than 30,000 children. It was able to uncover disparities in different populations and make recommendations on how to improve that within the clinic. See, I've included in the presentation a link to the study for additional for if you want to have additional insight on some of the challenges that they faced and how they resolved those. Moving on to key points. Just to summarize, there's a lot of advanced customization you can do to the EHR related to developmental screenings to enable not only keeping up with current screening tools, capturing that information discreetly, being able to look at trends as those screenings occur over time, not only for the same patient, but across similar patient populations within your clinic or within a community where there's collaboration within the local area. Again, automation that's now available within electronic health record systems allows these tools and this discrete information to automatically trigger referrals based on responses and really focus in on being able to improve the health outcomes of the people that we serve. Now, I'd like to open up the presentation to the time for any questions that anyone may have. Are there any questions, Teresa?
Okay, I'm going to check in the chat real quick. You can also put any questions that you have in the Q&A section. Let's Let me just check here. I don't see any yet. Let's see if any come in a few seconds.
Get back to this.
Seeing any questions yet, but if you could put up your
Yeah,
contact
let me.
information, should they have or go back to their
Yeah,
offices and consult with their teams and have any questions after. Awesome. That would be perfect.
before. There we go.
There we go. Okay, oh, I see one. Let's see here. Where can health level 7 be found?
There is the website. It's hl7.org. And it may be if you're looking for specific items, like for example, we go back to the like for this slide. You can see at the bottom. I just did a search for screening and implementation guides, or HL7 screening implementation guides, and because there is, you will find the information available on their website to be quite overwhelming at times, just because it's so broad and it's a combination of clinically oriented information such as implementation guides, but there's also a lot of technical information there if you're interested in it, and how the structures, how the data is captured, what the formats need to be, and so kind of the underlying plumbing of how interoperability works. And they've been doing this since the early 1970s, so there's a lot out there. But thank you.
Some question. See if we have any others. I don't see any other questions. So if y'all think of any and you'd like to email Mr. Richmond, please feel free to do that. Or you can email me as well, and I will get the questions to him. At the conclusion of today's webinar, you should receive a link to the survey, the evaluation. If you, once again, are seeking CME or CE credit for attending today's, or contact hours for attending today's session, please make sure to fill that out. I think that is all for today. Thank you all so very much for attending, and we look forward to seeing you next week at our last session. Thank you so
Great.
much.
Thank you. Appreciate your time today.
Thank you so much, Mr. Richmond.
Mm-hmm. Bye.
Bye-bye.